What's the weirdest thing you've been asked to do? I did once have a male patient who was born missing a nipple, but what we did was we grafted a piece of his scrotum onto his chest. So we made a new nipple from a piece of his scrotum. My name is Dr. Dan Marsh. I'm a plastic surgeon, and today I'm going to be answering questions from the Honesty Box. What was the first plastic surgery? So plastic surgery started a long time ago. There's some texts from the Indian texts a long time ago when people did, so they did some nose reconstruction. So they would take a piece of skin from the forearm, build it up here and rebuild the nose from there. So that's typically thought to be one of the first plastic surgeries. Favorite and least favorite procedures to do and why? All procedures I like. You know, I wouldn't do a procedure if I didn't find it interesting or enjoyable to do. Least favorite procedures, probably the larger patients who are having a lot of liposuction. You know, if you're liposucking 5-6 liters of fat, it's tiring. You have it's a vibrating cannula that you have, but you still have to do that, and you do that for maybe an hour. And it's very physical, so you're pushing down hard. The more you push, the more fat you get out, because you're squeezing the fat into the holes at the end of the suction machine. A lot of people don't do liposuction because, or they don't do it well because they don't push hard enough. You know, you're sweating, your gown's like soaked, you have to take it off afterwards. You know, so it's physical.
Keeps you fit.
Yeah. What fad procedures are the biggest cons? Yeah, this is quite an easy one. So pretty much any procedure which claims to tighten skin without having a full surgical skin removal, I would term as a fad procedure. So there are lots of techniques and machines which promise a lot, and they say, oh, we tighten skin, we shrink skin, we make it look really tight and really nice. And in reality, but the patients will have maybe like a 10% improvement in their appearance, 10% skin tightening, but still left with sort of 90% of loose skin. I've had, again, a patient spend thousands of pounds on these treatments, non-surgical skin tightening treatments. So those are probably my number one fad procedure, which I think doesn't work. What do you do with the skin that you cut off? Again, people always ask this. My standard answer is normally bags and shoes. But actually, the reality is it goes into clinical waste and gets burned. What is a BBL and why is it so dangerous? So again, this BBL is a Brazilian butt lift. This is a surgery where you use liposuction to suck fat from somewhere in the body, typically the tummy, flanks, upper back, or thigh area, and then you would re-inject it into the buttocks. Really popular a few years ago. The Kardashians popularized the BBL look. The reason it's so dangerous is because you're injecting high volumes of fat. Now that's fine if it's done under the skin and in the volumes where it's not too, when they're not too high volumes. So if you're looking at probably less than a litre or something, but people who were putting 2 litres plus into the buttocks. And sometimes that fat will go into the vein. The fat in the vein will then go round and lodge in the lungs, and patients would die because of the fat embolus or fat going from the vein up into the lungs. These days BBLs are done with ultrasound guidance, so you use an ultrasound probe so you can see exactly where you're injecting the fat. So that's why it's a very risky surgery. How much do you get paid? So an NHS consultant working as a plastic surgeon would earn probably 120,000 a year. And then privately, obviously depends how much work you do as to how much you earn. It can vary very much. So when you start off, you don't earn much more than you would do in the NHS. But I would say a busy plastic surgeon would probably earn 200,000-300,000 a year. Topical question, is it risky going abroad for cheaper surgery? The risks from traveling abroad for surgery really come from the follow-up afterwards. It's safe to fly. I always tell my patients it's safe to fly 6 weeks after a major surgery. Okay, so if you're traveling back within that 6 weeks, then you're at increased risk of problems like deep vein thrombosis, wound healing problems. And then what happens if you have a complication, you have an issue when you come back from surgery? If you pick a good surgeon, then hopefully the surgery should go well when you're abroad. But when you come back, who's going to look after your seroma? Who's going to look after your delayed healing? Who's going to change your dressings? You know, how's that going to be taken care of? We often get patients who've had surgery abroad and say, you know, I've got a problem, can I come in and see you? But I don't know what surgery's been done. They're not my patient, you know. And it puts a lot of onus on the NHS as well. So a lot of these patients would have surgery abroad, have complications, problems, and who's going to look after them? You know, so they come back and they go to the NHS hospital, which will look after you if it's a serious complication. But otherwise, you're left with perhaps uneven nipples, you're left with uneven scarring, all of these things. So it is risky going abroad. Is Botox dangerous long term? No. So Botox is a neurotoxin, which sounds terrifying, but actually, what Botox does is it blocks the neurotransmitters, which allow your muscles to contract. What happens when you use Botox long term is that the muscles will waste. If you block that continually for 5 years, 10 years, 15 years, then the muscle will waste and the muscle will get thinner, which means less wrinkles. So because the muscle's not going to work anyway. So actually the time between when you need the Botox treatments or you choose to have the Botox treatments gets longer and longer. Aren't you changing beauty standards for the worse? I guess this question is trying to get at what is a beauty standard. Whoever asked this question is thinking that am I trying to set the standard higher so everyone's got to have plastic surgery to look a certain way? I wouldn't say that that's true. I say that what I would do is, the job that I do is to make people feel better in themselves. I listen to what they want to achieve, what they want to change. Certainly, a great example would be a breast reduction. Patients they can't exercise, a lot of back pain, neck pain. Those patients are the happiest patients. It's really quite life-changing for a lot of my patients. So I think setting standards for the worst is probably not a good way to look at it. There are plastic surgeons, and plastic surgery itself has a bad name in some fields where, you talk to people, like someone on the street, say, oh, what do you think about plastic surgery? They say, oh, it's like celebrities having tweaks and lifts and things like that. But that's really not what plastic surgery is. Plastic surgery is a normal procedure to change something that someone dislikes about their body. What plastic surgery do you wish people wouldn't go through with? Okay, so this is quite an easy one. I think plastic surgery that significantly changes your appearance to something which is abnormal. There are surgeons around the world who do things like the fantasy nose, or they change people to things which are not anatomically possible. You can lift the corner of the eye, have like a sort of cat eye appearance. Any of these surgeries that are significantly changing and alter things beyond what is normal anatomically, I think surgeries like that are not, I would wish people didn't go through with. There's a reason your nose is designed as it is. If you make it very, very small, you reduce the airways. I've seen patients who've had surgery, had this fantasy nose, and they're just unable to breathe afterwards because the nose is so small. So for sure, that's, we've evolved and developed to become humans as we are. So I think if you're deviating from that significantly, then you're going to get into trouble. Is penis lengthening surgery a myth? So there is a ligament at the base of the penis which you can divide, which can technically lengthen the penis when it's flaccid. In terms of lengthening an erect penis, that doesn't work. Is it true that some implants can cause cancer? Breast implants do not cause cancer by themselves. There's a type of breast implant which is quite coarsely textured, which we don't use anymore. And there is thought to be a 1 in 30, 1 in 40,000 risk of someone developing a lymphoma, which is a type of blood cancer, and that's associated with the capsule around the implant. But breast implants themselves don't actually cause cancer. What's the weirdest thing you've been asked to do? I did once have a male patient who was born missing a nipple, but what we did was we grafted a piece of his scrotum onto his chest. So we made a new nipple from a piece of his scrotum, which actually worked very well.
Wow, that's impressive. Why did you use the scrotum?
So in breast reconstruction, it's a well-recognized technique to take a piece of the vulva and use that as a skin graft to reconstruct the nipple, because it looks. You may or may not believe this, but actually the vulva, a certain part of the vulva, the color of a vulva looks the same as a nipple. So that's a well-recognized reconstructive procedure, and I took this one stage further and thought, well, actually the scrotum's probably a little bit like a nipple. So we cut a small disc of it, it healed well, we stitched it up and sewed it up. You couldn't see where we took the graft from. And then actually, it reacted well and looked like the other nipple.
And you came up with that?
Yeah.
Do you invent procedures all the time?
Well, pretty much everything's been done before. So people always say in plastic surgery, if you think you've got something new, you go back a generation or you look in the German literature. So it's pretty much all been everything. So there's very few new things, but you change things how you do it. You're constantly evolving, but it's not new. It's just an evolution of a previously done technique. Has social media changed what patients ask for? So yes, I think it really has. It's a double-edged sword because more people are asking for surgery. Surgery is more accessible now than it was many years ago. But equally, people's expectations are higher, and it's really, really important that you set expectations at the right level, and achieving a look which is a filtered social media. The picture that someone's put on social media is often not possible. A lot of them some of the images are very dangerous. People edit their waist, their super narrow waist, big bums, big breasts. They're just simply anatomically unachievable. A lot of it's done in a subtle way, so you don't notice it, but as you know, the majority of pictures on social media are edited. What would happen if a silicone boob leaked? Well, actually, I've got one I can show you. Fake boobs can get up to a reasonable size. This is one of the larger ones which I'd use. This is 450 cc. They do go up, the standard ones in the catalogue, up to sort of 800, 900 cc, which would be obviously twice as big as this. Different types of breast implants. We've got teardrop implants, which is like this, but these are fixed anatomical implants, quite a thick gel. And the risk from these ones is sometimes they can rotate and be upside down. So what you don't want to do is have an anatomical implant that rotates. So these are becoming a bit less popular these days. I tend to use this type of implant more. This one is 300 cc, which is a fairly standard size that we're going to use. But although it's round, if you look at it from the side, it hangs like a teardrop. So the shape is pretty similar to the teardrop. And if these ones rotate, then it doesn't really matter because the gel's always going to sink to the bottom. So everyone's worried about breast implants leaking, ruptured implants. What happens with a modern breast implant is if you cut the implant in half, the two halves are going to sit there. So it's much like the inside of a jelly baby. So you can have the two sides that are sitting there, and the gel's not going to leak anywhere. So it sits together. I can cut one if you want.
Really?
Yeah.
What do you need?
Knife. There you go. If you have a breast implant, you can actually cut it in half. And the gel within them, you can see actually, is a cohesive gel. So the two sides of the implant are just going to sit there. So actually, it's not that it's going to leak everywhere because this gel doesn't come out. So you can cut them and do this, but the gel itself is quite sticky. So if you bring it together, when you take an implant out, it tends to be sticky like this if it's leaked and is ruptured. But you can see it's safe, so it's not like you're going to have gel running around all inside the body.
Can I touch it?
Yeah, it's really sticky.
Oh yeah, oh that is sticky. Bloody hell. That's amazing. And that's silicone?
Yeah, this is silicone, yeah. When you've had an implant in your breast or in your body for any implant, be it a medical device like a pacemaker, a hip replacement, breast implant, your body will make a scar tissue or envelope around that implant. So we call it a capsule with breast implants. So if it does leak, it doesn't go into your body, or on very rare occasions, you can have an extracapsular rupture, which typically with the older implants. And in that situation, sometimes the silicone could go into the lymph nodes under the arm. But I haven't seen that for many years. Do you have a God complex? No. Do you think any of your clients are addicted to surgery? So, for sure, there are patients who are addicted to surgery. Probably not in the way that you might think patients are addicted to surgery. So a good example of this would be patients who've lost a lot of weight. So we would have, I had a patient who'd lost 100 kilos and still weighed, 80 kilos plus. He had a lot of surgery. So we would operate on, we did abdominoplasty, we did upper back lift, we did a breast lift, a gynecomastia, a chest reduction. Is he addicted to surgery? When he kept coming back for more, but I think it's because every time you do it, they feel better and there's still some more skin to go. So the typical thought of whether someone's addicted to surgery is somebody who has endless facial fillers, more tweaks, and the extremes of plastic surgery that you hear about in the press and see on YouTube and things like that. I don't have any clients like that, and that's rare. The patients who say, want to have breast implants, I want to go bigger. I just don't operate on those patients. I won't see them.
Is that your moral responsibility?
Yeah, I think you're a doctor. Well, you are a doctor first and foremost, and secondary, you're a plastic surgeon. So you want to make sure what you do is safe. But if you're having multiple procedures for small gain, then that's not a way to treat people or behave as a medical professional. What's the best value surgical operation? I think it's important not to think of surgery as having value or not having value. It's really important that you think of surgery as surgery because you either want or need that surgery. To think of it in terms of value is, I think, the wrong way to look at things. Possibly a good operation would be a blepharoplasty for the appropriate patient, so it's a common surgery. In terms of sort of bang for your buck and like the best result you get from that, a blepharoplasty is a small incision just above the eyelid. A lot of people as they get older have excess skin, and you can really open up the eyes from a very small surgery, which is quick. The recovery is generally quick, about 1 to 2 weeks, minimal bruising, very low risk, and pretty much all patients are pleased with the results of a blepharoplasty. How many things can you get done at one time? This again is really important. So the answer is you can do as much as you want at any one time, but the more you do, the higher the risk of complications from that. I'll always keep my surgery time for a single patient under 6 hours. Other way to look at that is what's recovery going to be like? You know, if you're going to do arm lift, thigh lift, tummy tuck, breasts, all together, and number one, that would take more than 6 hours. And number two, your recovery is going to be awful. It's going to be really sore, you can't get about. You generally need one set of limbs to get about, either your arms or your legs. So we typically don't do thigh and arms together. People always want one recovery. And there are certain surgeries that go together, like breast and tummy we do together a lot, but you wouldn't do tummy and thigh lift together because the thighs, the skin's pulling up, and the tummy's, the skin's pulling down. So the bit of skin in the middle, there's a lot of stress on it. We typically do two, at the very most 3 procedures together.
What's the most amount of money one of your clients has spent for surgery in total?
Yeah, so it depends. So typically, the sort of top end would be about £30,000 for one person. That would be sort of breast, tummy with some liposuction. There are some surgeons who would charge £50,000, £60,000, £70,000 for a facelift. I don't charge anywhere near that, but some surgeons are charging that. How old are your youngest and oldest clients? So typically, well, because I only work privately these days, my youngest client is going to be 18. Because I don't work in a hospital where you can operate on patients who are less than 18. I have carried out an abdominoplasty on a lady in her 80s. You obviously have to do things slightly differently then, a little bit less aggressive with the muscle tightening and the skin tightening, but age doesn't really matter. It's just a number, a bit of a cliche, but it's true. And actually, you can have patients who are in their 50s who look like they're 70, patients in their 70s who look like they're 50. So as long as patients are fit and healthy, understand what procedure they're interested in, then actually you can have a great result from it. So age doesn't particularly matter. Is it true you need to break the nose for a nose job? So nose job is a sort of common name for rhinoplasty. So the shape of your nose is determined by the bony structure and also the cartilage of the nose. So we do sometimes break the bones, the nasal bones up at the top, to try and reshape the nose, so you can narrow the bridge at the top of the nose. When you see these 2 points here, this is the bone. So if you want to narrow that, yes, you've got to break the bone for that.
What are you using to break the nose?
We use a chisel, so a very fine chisel. Well, there's 2 ways. One uses a chisel, and the other is called a piezotome, which is a sort of ultrasonic thing. But you make a little incision in here, and you use a hammer and a small chisel, and you put it here, and you tap the end of the chisel, and it makes like postage stamp sort of perforations in the bone, and then you can just push it across. How often do you see patients requesting surgery to mimic celebrities? I don't get many patients come in and say, oh, I want to look like Kylie Jenner, or I want to look like this person. That would be quite a big red flag for me in terms of a patient wanting to look like somebody else, because the biggest thing that influences how you look after plastic surgery is how you look before plastic surgery. So it's not possible to create a certain look or a certain attribute that a celebrity may have if you're not very close to that to begin with. Have you ever said no to performing a procedure, and why? I say no all the time. So I would suggest a turnover rate probably between 20 and 30% of patients. Very important that what the patient wants is achievable. You know, often patients come in, they would ask for something which or they want example today, I had a lady, she wanted some liposuction. She was like a size 8, had hardly any fat on her, but was still concerned that she was full here, had some fullness, wanted some liposuction. She looked absolutely amazing. There's nothing I could do to improve her in any way, and it would be completely wrong to offer her any surgery. And of course, she could have had liposuction, but I would have got out maybe 50 mils of fat or something, and it's just not worth doing. It's, you know, it would have caused irregularities. But I do see patients who have had procedures which I think would never have worked, completely unnecessary, who've been somewhere, spent thousands of pounds somewhere having this done, look the same or worse than before they started. So there obviously are some practitioners who do that, but thankfully it's rare. Worst botched surgery you've ever seen, and could you fix it? The most common thing that I adjust or fix is patients who've had breast implants that are too large. I've had patients who've had surgery abroad where they've had a breast uplift, the nipples are pointing too high up here. So what we do is adjust the base of the breast, so you have to elevate the whole breast almost to an unanatomical position. So the nipple, because you can't lower the nipple significantly, so you put the breast implant here and you lift it up, which gives the appearance of the nipple being in the right place. It's not a particularly worst surgery, but it's probably the most common one that I deal with. Have your clients ever been disappointed with your work? So this happens sometimes. So patients are disappointed for two reasons. One, because they haven't got the look they want, or they may be disappointed with that they've got the look they want, but actually the scarring is poor, or they haven't healed as well as they might think. And there are many, many reasons for that. You would think about, we always optimize patients, so we don't operate on patients who are smoking, we don't operate on patients who are overweight. We make sure that patients are fit and well, not taking other medications. Maybe breast implants is probably one area where it's quite difficult to know what you're going to look like afterwards. So there's got to be some element of trust and rapport with your surgeon to give you what you want. It's quite common for patients who've had breast implants to wish they'd gone just that little bit bigger, because there are a lot of patients who are quite cautious about having implants and don't want anyone to know they've had surgery. They don't want the fake stuck-on look, you know. So they choose a smaller implant, and then they come back and they say, oh, I wish I'd gone that little bit bigger. Or we have patients who, typically I'll say, okay, you can have like a 250 or a 300 or something like that, and I'll try and talk people up just a little bit to try and negate the fact that they may be afterwards that they wish they'd gone a little bit bigger. So we try and adjust that, but of course there are always some patients who are disappointed.
Do you think it's morally right to perform this type of surgery? I was waiting for this question, it always comes up. Of course it is. The patients I deal with are trans women, so they start out with male anatomy, but they have a female gender identity. If you don't offer them appropriate support, counselling, and in the end surgery, we think about 1 in 5 of them commit suicide.